Painless, non-invasive, life-changing technology. That's what Flagstone Medical offers to men suffering from erectile dysfunction. And patient care advisor Bill Jeffries is back here with us to walk us through it. Bill, always a pleasure to see you.
Thanks, Alex. Good to be here.
Thanks so much for being here. So it's called acoustic wave therapy, which makes it extremely different from the old standby ED treatments that we're used to, like, say, oral medications and injections, right?
Correct. Those types of approaches deal with the symptoms of ED. They call them vasodilators, and what they do is they attempt to dilate the blood vessels to allow more blood flow, because ED really is just a blood flow issue. What's different about acoustic wave therapy is that it deals with the root cause of ED, that poor blood flow, by breaking up the blockages, eliminating the plaque that just naturally forms in our arteries as we age, and restoring blood flow naturally.
Well, excuse me, it restores that blood flow, it restores the function, but it does a lot more than that, right? We talk about restoring hope, and why is it that we say that?
Any guy that has struggled with ED for a while can attest to this. There's a lot of false promises out there. The ED medications have their place, of course, but over time they tend to not work as effectively anymore. A lot of guys can't deal with the side effects, or they're taking other medications for other medical conditions that just make the ED medications not practical. Finally, medical science has caught up with erectile dysfunction, and we have a breakthrough technology that will restore function naturally without the need for those drugs.
Well, it's one of those topics that has been a little bit taboo, right, up to this point, but it's something that we need to discuss, something we need to talk about. But for some guys, I imagine it would be, maybe it would feel awkward at first to have to address this, but when a guy visits your office, it's anything but awkward.
That's true. They usually are feeling a little awkward in that first phone conversation, but once they come into our office and realize we've taken great pains to make it not be awkward. Yeah. We have an all-male staff. The other thing that they'll notice is we're not a general doctor's office. We don't treat other maladies. All we do is treat ED all day, every day, and we work hard to make patients feel comfortable in that environment.
Right, and who are the professionals that are going to sort of help walk them through this there at the office?
Well, in addition to our staff physician who examines every new patient coming in, the medical technicians that actually perform the treatments have years and years of medical experience. They have EMT and paramedic backgrounds. Very, very well versed in physiology, human anatomy, that type of thing. And they've been specifically trained in acoustic wave therapy, and there's ongoing training. So we're just always out there on the forefront of the latest training and protocols.
Yeah, so you know you're in good hands. You know you're getting the latest, like you said, latest technology and protocols. How about a referral from another doctor? Is that necessary? Because most people think, well, if this is a specialty office, maybe I need a referral, but do we really need one for Flagstone?
None needed. We never discourage a patient from talking to their family doctor, primary care physician about anything that they're doing medically, and certainly this would be an appropriate topic to bring up, but a referral is not needed. They can just call directly, set up an appointment. The process starts with a visit with our staff physician, who will give them a thorough exam and make sure that the treatment is suitable for them.
Excellent. And of course, ED, you know, it's a very specific physical issue that affects the men in the relationship, but it's really more than that, right? It affects a couple. It's a couple's issue, would you say?
It really is, yes. We often have the significant other is the one that's making that first call. Many times what happens is, you know, somebody will hear one of our ads or see one of these segments and say, wow, my guy needs this, what do I do? And they'll call and just get educated, and we encourage people to do that. We're happy to talk to folks and educate them. Many times the couple comes in for that initial consultation because it really is a couple's issue. It's not just a guy issue.
Well, and I'm sure you have words of wisdom, you know, for our viewers. Address the issue as early as possible, right? Don't let it wait. I mean, things like this sort of store themselves inside if you're struggling with it, and it can have effects on the relationship that you never anticipated. So what other encouragement would you give our viewers to just, you know, take charge now and start the conversation?
Just make a phone call. We'll be happy to talk to you. We're very low key and happy to dispense information. We've assembled probably the most talented team of ED specialists, if not in Southern Arizona, the whole state. Yeah. And we're happy to talk to people and just help them get the treatments they need.
To get the word out, and most importantly, to get educated. That's where it all starts. So Bill
Yes.
Jeffries, as always, thank you.
Thanks,
Nice to
Alex.
see you.